We have Anna with us today, and just started as a new person today, right?
Yes.
Well, you're not a new person. You're actually a new patient in the office. Right,
Mm-hmm.
good. Not a new person. Okay, so what I'm going to have you do is just do a few things just to look. Raise your eyebrows up, way high. Okay, so when you look at this, you see that this one isn't raising quite as high. Smile, just like that. And what we're seeing is we're not seeing as much muscle action here on this side as that side. This is 7th cranial nerve here. When she sticks her tongue out, let's see, we get a little small amount of right deviation right there. When she says ah, you can't really see it. You get a palate lag on the right. Go ahead and stick it in. And just go ahead and stick it in. That sounds so bad. But you get a right palate lag, and what that means is cranial nerve 9 and 10 are not functioning properly. So what we're seeing basically, cranial nerve 7, cranial nerve 12, and cranial nerve 10 and 9, all deficits on the right hand side. Now if you'll back up just a little bit, I want to show you something pretty interesting. If you look at the right side of her hand right here, you see that right there? That's what's called osteoarthritis. Used to be called old age arthritis. It's really not. It's an inflammatory process. But if you look on the right side, you see it on the right side, you see the left. Now pan down here and let's look at the feet. Raise your toes up on this side. You see that? Now raise them up on this side. See what happens. She can't do it. So, and what'd you say about the numbness in the heel?
I have numbness in the heel, the arch, and sometimes
in the
ball
right.
of the foot. All
okay.
the right.
The point I'm trying to make
None
here,
point
I'm trying to make here is this is a head position problem that's causing deficits in the cranial nerves, but it's also creating deficits that this is growing. This is a long-term problem, growing arthritis here, and also the leg problems that are going on. Very interesting. I actually took a stethoscope and I listened to bowel sounds. And on the right side, she had hardly any bowel sounds, and they were normal on the left. So the whole right side's messed up is because the head's in the wrong position, putting pressure, or I should say compromising the function of the brainstem on the right side. And 2 years ago, when she first started having problems, what did you experience? What happened?
I experienced at first disorientation.
Okay.
Okay. And that went on for months.
Yes.
And then I got up one morning and left knee cartilage was gone on the left, and when that happened, everything just fell apart.
What kind of symptoms did you have? What kind of symptoms have you had over the last?
The biggest symptom I have had out of all of this is swelling.
Swelling. Joint pain, swelling.
Yes. Swelling.
Okay. And IBS.
IBS. Big time.
And even to last October, you had to have a colostomy.
I had my colostomy put in.
Right. And so bouts between diarrhea, constipation.
Diarrhea, constipation. It would happen always in the morning.
Okay.
And it would happen. It would be 20 trips to the bathroom.
Right.
I'm talking a half an hour time. I'd be back and forth.
So now, I'm not picking on her, I love the story, but I want to show something. When she's talking and when you're observing patients, just watching them, when she's talking, you watch that right eyebrow. It doesn't come up like the left one. That is a facial nerve deficit. You watch how the mouth moves. These muscles are controlled by the facial nerve. Okay, so this whole process started as an inflammatory, a major inflammatory problem right here. And I believe that a lot of the origin of this is coming from that brainstem malfunctioning. I think the brainstem is seated control of the autonomic nervous system. The autonomic nervous system is what's primarily controlling the immune system. And after doing an exam, and we did a blood work today, I can tell you that your immune system is just gone rogue. It's gone crazy on you. So we've got to get that in check.
Let me mention on the right foot, when I started the swelling, I had so much inflammation that I had cracked at the seam right here, and literally had water coming out.
Yeah.
That's how bad it was.
Yeah.
And you could see it was bad.
You know what? You're going to get so excited because you're going to get well.
Thank you.
Awesome.
I cannot wait to get better.
Okay, good. Well, I appreciate that. That's good. Thank you. Perfect. Right there. Oh, my goodness, that's perfect. Now let your stomach fall. Shoulder drop. Relax, relax. Oh, my goodness, and that's how it goes.
Wow.
Did you hear that? Anna, you just had your adjustment. How you feeling? How'd you do?
I feel good. I'm feeling a little bit more relaxed.
Cool. Very good.
Yeah.
Are you ready to be on the path of getting well?
Absolutely.
You're on the path now. So, all right. Thank you.
Thank you.